today? More than ever, HR professionals need to stay in the know to remain compliance and culture savvy. This podcast is about creating space for HR professionals to make sense of that delicate intersection and take away something valuable that helps you, your organization, and of course, your people. We'll unpack state and federal legislation, agency activities, court decisions, and so much more impacting the HR community right now. Here comes a disclaimer. Go ahead and read that. These days, you've got to be careful. Okay, that's good. You're getting it in. Now, let's get this conversation going. I'm your host, Tracy Justice, with co-hosts Rachel Gwynn and Chris Schrader. Who's your HR? Let's go.
Hey.
All right. Welcome. Yes. So, it's really
glad to have Rachel back.
Yes. Because last session, because I wasn't feeling too well the last session, but I had already, kind of moved over because you and I weren't feeling that well. And then last time I wasn't feeling that well. And then I was having technological issues with my computer. So that's why I just jumped on Chris. And so that's why when you came on, you're like, I'm sorry, but it was okay because I wasn't feeling well. And I figured I was just going to go with it. But I'm happy to have both of you all here and everything's working. I think I feel like I'm slowing down. So if I tend to kind of slow up, I'm just going to take myself off just so that I don't mess with the bandwidth. But we tend to have great conversations before the show starts. And then the show starts and it's kind of like, but so what I want to do is I'll start with you, Rachel. How are you doing? And then what updates would you like to share? Well, okay, before I do that, I do want to talk about HEA 1044, if that's on our bandwidth, if we're able to talk about that today, because I did meet with a few HR professionals and I got a little bit more questions from them. And so I kind of want to keep this conversation going because the goal might be policy revisions for next year on this particular bill. So we definitely want to do that. But okay, now jump into Rachel. Rachel, how are you doing? And then do you have any updates you'd like to talk about?
Well, I'm happy to jump into HB 1044. I do want to touch on, if we have time, that the FTA has pulled back on any EEO reporting requirements. That's the notification I got. I'm assuming that is going to translate into other industries that for federal contractors, regardless of what agency you fall under, the FRA, the FTA, it could be, a myriad of things. But that's a pretty big deal. And I had a conversation with a client that is impacted directly by that and kind of what that means for them moving forward. And so happy to touch on that, but also with HB 1044, I was able to get on the phone with the Fort Wayne fire chief earlier today and talk to him about this law and the impacts that it would have on the city of Fort Wayne, which are minimal. But we did talk through it a little bit.
Okay.
So happy to address that too.
Okay. So since and Chris, are you okay with touching on that? Because I know we kind of talked about it a little bit. So on the last session, but not really down into deep with it. I know that I was talking to Chris about it. So let's talk about what it is, right? So what it's doing is providing access to Class 1, Class 2 public safety employees who have been designated with the Class 1, Class 2 from INPRS. And it gives them access to active employee insurance rates. But there was a lot of questions around that, right? Like, what if somebody else is working another job? Because the bill included a look back period from January 1st of 2020. So, we don't know what some of the situation of the employees could have been at that time. But it seemed like a lot of the concern is, does this just provide cheaper benefits to, public safety employees if they've had another job? Does that mean that they can quit their job and just, be able to have access to this insurance? Does this mean that, their spouse, is able to just, get on this insurance at another point? Maybe they have employment when it looks like your stream isn't showing up on LinkedIn. Huh? Interesting. So, okay, so then I'll fix that. But I just got that issue on my end. So I'll fix that. I'm sorry I had to say that out loud, but that's the way I think about it. So it just was, Because Chris, after we had the conversation about it, it seemed like it was pretty cut and dried, like, it was going to be no issue. But when I got into the room with the HR professionals who are actually responsible for administering it in the, the public sector HR roles, and they had some serious questions. And then at that point, I was just like, I wish I had Chris and Rachel with me.
Well, actually, I'm glad to have Rachel.
I'm
glad to have Rachel here because Tracy and I, I asked the question because they clearly I thought they identified in the bill, who was the public safety official. And so then I said, well, wait a minute. What about the EMTs that travel with the fire trucks on runs?
I didn't question.
Right. Because there's, it isn't like, my mom used to work for the fire department. She was the executive assistant to the fire chief in Indy. And so I probably dangerously know more about fire department operations than it's healthy for speculation. But one of the things she always talked about
HR for firefighters. So that's why, and I used to do HR.
No.
So
well, the reason I asked the question is one of the things that she used to say, one of the most misunderstood by the public in terms of how expensive it is to operate, fire safety, because she always used to say, hey, it isn't like we throw up the doors when somebody says there's a fire and we only send out one truck. I mean, you're getting the ladder truck, you're getting the 2 pump trucks, you're getting the box truck with the medical, the EMTs on it that are actually fire department employees, but they're EMTs, and you're just getting the whole show, right? It doesn't matter, once it's called in. And she used to say, it cost us X many $1,000s just to throw the doors open and run, and so that immediately made me think, I was listening to Tracy describe them. Well, what about the EMTs? Are they covered by this also? And I didn't know how to answer the question. And I haven't read the bill thoroughly enough to know, but they didn't seem to be called out in the description as public.
I know.
I was hoping you would.
Yeah.
Of course we know you. Yes, definitely.
Yeah. So that's a really good question. And so how EMTs are treated depends on each individual community and how they manage their EMT services. So in the city of Fort Wayne, we have Three Rivers Ambulance Authority, and they are the designated EMT paramedic provider for the city as it relates to transportation. So all firefighters in the state are at a minimum base level EMTs.
Sure.
Many, reach paramedic levels, but in the city of Fort Wayne Fire does not transport. So our EMTs are not government employees. However, what you're referring to and what we have in the unincorporated areas of Allen County is what we call fire-based EMS. And so if you have fire-based EMS, those EMS providers are typically both firefighters and EMS providers that participate in the transportation of patients as well. They would be covered by this. However, if you go to a private sector EMS base that can also be taxpayer funded, and that is something that our unincorporated Allen County is looking at doing, they're calling it a civilian EMS service, they will not be governmental. So it's all about whether you are tied with or designated with that fire-based EMS, or you are a separate quasi-governmental or private entity. So in Indianapolis, you have private companies, right? And so and you all have a system where the 911 call comes in. I think I'm correct on this, and the closest ambulance arrives on scene and makes a transport.
Responds. The classic HR.
Hendricks County does have like they do have that sort of agreement.
And we have worked diligently.
Okay. Well, then I have. Okay, go ahead.
Oh, go ahead. That's okay. With respect to once you raise the
go ahead.
The garage door and everybody kind of comes running. We've worked really hard here to minimize unnecessary resources being called out on a call that's not needed. And so we've implemented a lot of protocols in collaboration with our fire department, our hospitals, and our EMS provider, so that when the call comes in, we go through certain protocols to determine, okay, who actually needs to be there, right?
Yeah.
Is this someone who's fallen down and our firefighters can come and help get them back in their chair? Is this someone who's likely going to need transported to the hospital? And so that has really helped to reduce some of that waste, I think. And we work really hard to keep those taxpayer costs down by having the privatized EMS still here. So
it was funny when you talked about managing costs, because I told my mom at the time, I was like, that's super wasteful. I mean, why can't they ask questions? And she said, when the fire's called in, it's only one house, but 15 minutes after the truck gets there, it's 3 other houses.
Sure.
So I said, you can't arrive short.
Well, yeah. No, that's very true. And when there's a legitimate fire, that's a completely different conversation.
But
there's another factor in this, which is over the last, I want to say 50 years, because of all the safety measures that we have, smoke alarms, all of those things that science has helped us advance with, and even the materials that we use to build houses, and buildings and things like that. The actual fire calls have been reduced. I don't know the statistic, but it's really substantial. I want to say maybe by 40 or 50% if you look back.
That's great.
So those calls are down where the EMS is up. And so, but for the city, even taking the ambulance service out of our annual city budget, public safety is our number one cost. So fire and police, it is expensive to employ government employees and provide the resources and the training and the perf, and all of those things.
Yeah.
And so,
plus the fact that you can die.
Well, So then I guess the question is, like, do you foresee, could you, see how there could be opportunities where, people could take advantage, right? Because it's not about being against this bill, or this law, because of course we definitely want to, make sure that we're taking care of people that are running into, into fire and in scary situations where everybody else is running out of it. So it takes a certain level of risk. But could there be any reasons why HR professionals who have to currently administer this and be on top of this, could there be an opportunity for public safety employees to take advantage of this without HR really being able to get a handle of it, or
okay, so
to the access?
And so again, in this, and I'm speaking about the city of Fort Wayne, it is not state mandated, but that's what one of the things this bill is proposing to do. We already offer this, right? And we are one of a few across the state who do. And we also pride ourselves in being one of the top notch. I mean, we have your insurance, your homeowner's insurance is lower than most other places in the state because of the level of fire care that we provide here within the city of Fort Wayne. And one of the reasons we have such amazing firefighters is because of the great benefits that we offer. So we don't have work comp, we have hurt on duty, right? We offer these lifetime benefits that go beyond. So that was what my takeaway with the.
Hold on, so take a step back, Rachel, with that. So I like what you just said. So you said we don't have workers comp, we have hurt on duty.
Right. Yeah.
Unpack that a little bit more. What do you mean by that?
Sure. So for both police and fire in Fort Wayne, Indiana, and there are other communities that have this, but our employees, if they are hurt on duty, they get a minimum of 1 year of completely full pay and benefits while they are off. And then if beyond that period of time, they have ongoing injuries or care, we continue to pay for that care at 100%. It could be 10 years from now. One of the examples my fire chief gave me is if you had a back injury today, and in 10 years, you call our risk manager and say, hey, my back is acting up again. She'll say, okay, either send us the bill or we'll manage the care for you and get you in. And so that's hurt on duty. Work comp goes through the state. Now, fire and police have additional protections than traditional work comp, but it's more of a payout system. We'll give you a lump sum. If you need ongoing care, we'll kind of buy you out. Whereas if you're in the city of Fort Wayne and you're hurt on duty, you get there's a calculation of where you're at in your employment versus where you need to get to reach your full retirement. And we will pay you through that time, not at your full pay, a discounted rate, but you will ultimately receive your full benefits if you are not able to continue to be a firefighter. And those requirements are very high, right? I mean,
Sure.
you have to be in very good health to pass an annual physical. And you had asked a question earlier about, I'm losing my train of thought, but it was something to the effect of, can you work a second job? And absolutely, most of them do. And many of them are business owners. And so, yes, there is no limitation on whether it's not whether they can work another job, it's whether they can work this job.
Correct.
So
Okay, good point.
Yeah.
Okay.
Yeah, and we call
So
that.
does it sound like you're saying, just to clarify real quick, so are you saying that, maybe that's not a concern that HR professionals should have then? Because I think that one of the things that they're thinking about is like, how can they afford to pay for benefits?
Well,
that's the concern.
That for a long,
Yeah, so something I need to understand, Rachel. It sounds like this hurt on the job plan sits in front of the workers' comp exposure, correct?
Yeah, it is.
So this is great. So I mean, that's really modifying your rates favorably on the workers' comp side, because in essence, you've got from a underwriting standpoint.
Well, we're self-insured.
Yeah, of course.
Okay, a lot of self-funded.
Self-insured on both sides.
Yeah, self-funded. Okay.
Oh, okay, never mind.
Yeah.
But, okay. Well,
Very good.
It just helps you on reinsurance then.
Yeah.
But Tracy, I did want to say what Rachel's describing in disability lingo, which is very common to have an analysis. So let's say someone is disabled, and let's say, because I've had this happen, right? Private employers oftentimes have short-term disability, long-term disability. Person gets really injured, blows through the short. Now they're into the long-term disability. And now they're going to start trying to figure out, hey, can this person kind of ever come back? And most of those policies, or at least the ones that you should design them this way, have what's called an own occupation disability, which is kind of what Rachel's describing. Can you do this firefighter job? That's the first analysis, right? And so then if you can't, okay, then it moves down to the next analysis that says, can you hold a pencil? I think about it in white ranger. And then they're going to make a determination of that, right? And then if you can't even do that, well, then you're just long-term disabled until Social Security kicks in. But that's not the process she's describing is a pretty common one for anybody that's ever done disability.
I think that one of the differences when we're looking at public safety that makes it unique. The process is the same, but the health requirements, at least in the city of Fort Wayne, are if you have any kind of like heart arrhythmia, right, you can no longer be a firefighter. And so that's this may be something that that just happens. It has nothing to do with work. It could be a genetic condition. If you develop that, then this 1044, and let's say you're outside the city in another community that doesn't already have the requirements we have, then as I read this statute, you are now eligible for the health care from whatever the community was, municipality, for indefinitely at the regular rate of pay or the regular rate premium of any other employee who's continuing to do that. If you die, it can, or while you're working, again, can be completely unrelated to the job you're doing. If you just have a heart attack and pass away, or an aneurysm, your spouse or dependents are eligible for that same care at that same price. So that's that's my read. With respect to costs, I don't know that it's the HR professionals. My experience in this is that it is the fire chiefs and the police chiefs and the mayors or the commissioners, the county council, who have to figure out these budgetary items, and I suppose it maybe depends on the size of the community and who's making those judgment calls. But those are the ones who are going to, whether it's city council, county council, and presenting their budget and hoping to get it passed. And so they typically are going to be in the government space, the ones who are having to figure out what this cost really means for them and how they fit that within the limited taxpayer dollars that they have. And I can tell you that this then relates back to SB1, which has created substantial challenges for public safety across the state, particularly in urban areas and cities, because of these property tax caps. So the city of Fort Wayne is over, well over $10 million of a budget shortfall heading into the next tax year. And we are having to look, and I say we as just a member of the city, at where we make those cuts. And with public safety being our largest line item, we are analyzing that and how do we draw that back. And our firefighters have an entire year of disability pay off that it doesn't have to be work related. So 100% of their pay. So if you go to Mexico and drink the wrong worm on vacation, right? And you end up with some terrible, disease in your gut, and you come back and you are off for 12 months, the city of Fort Wayne pays 100% of your pay and benefits for that time while you're off. And it's a good benefit.
Okay.
Looking at SB1.
No, it's a great benefit.
Oh, no, I was going to say that's straight out of the 70s.
Yeah. So they don't have sick pay, right? I mean, like a lot of other city employees do, but public safety does not. They get this other really great benefit.
Right.
And so the city tried to pull back on that this year and reduce it to 9 months. It was arbitrated and the city lost. To try to meet that budget.
So this is crazy.
Overtime issue.
Well, I'm just going to say that's in the labor agreement, correct?
It was in the labor agreement. And
so
the city tried to make the case.
It was worth a shot to go.
Yeah.
I'm unsurprised at the arbitrator's decision.
Yeah. So, and the other unique thing is that these unions are elective, right?
Right.
So there is a balance but they are very strong, so fire union, police unions, very strong across the state, very politically connected. Yep. And there's, as these budget shortfalls come in, it will be interesting to see how communities cooperate with, or how they work together, because there's got to be a meeting of the minds at some point. The cities, the enabling legislators that allow the unions to exist can say no more. And once you don't have a union, you no longer have bargaining rights. The concept of arbitration is completely out the door, and they can do whatever they want. Right. So there's got to be some give and take, because at some point, if you've got to make the budget work, right? It's really interesting.
It's interesting, because there isn't, like, because I know one of the questions Chris had at the on the last session was, what about the sunset? There's probably a sunset. I was like, no sunset on this bill. This is just something that's moving on. So then another question that came up was, when we look, because it is statutory law, what about like the insurance companies that may not have included something like this, as part of their options or benefits, or made a process for HR pros to be able to access, to be able to make this happen? What's the requirement for all those other stakeholders that might be involved? Because my answer to that was that since it's the law, they're just going to have to comply and make whatever happen needs to happen. But what would you say? Did that question make sense?
Yeah, it makes a lot of sense.
What would you say? Okay.
Yeah, Chris, do you want to jump on that?
Well, I was just going to say, most of these entities, and Rachel, said it earlier. Most of these entities that are affected are most likely self-insured, except for the poorest, probably. You move to the poorer counties and things like that, and they may not have the wherewithal to do self-insurance. But they'll still have to comply. But when you're self-insured, you have more options. When you're fully insured, they just tell you. Well,
and this is, I think,
Okay, that was a good point.
So I'm going to be careful because I don't want to be too political on this. But we are seeing it at the state, both from the governor and the legislature, that they are really putting a lot of pressure on the larger communities in our state with SB1. And for communities that do not already have this, it will cost substantially more money, particularly for those that are self-insured, because yes, it says premiums and you can stay on the insurance, but that also means if we're self-insured, we're going to continue to pay for all of your health benefits and your family's health benefits indefinitely, right? So
indefinitely.
the cost burden from
Yes.
that is overwhelming.
Yeah, that's a really good distinction to draw there. Right?
And so the larger
I think
the community, the more likely it is you're self-insured. The smaller the community, the more likely it is you're eligible for a cost-effective plan. At the end of the day, the taxpayer is going to carry the weight of this.
Oh, sure.
And so what they're
Exactly.
saying, what they're saying to the city of Fort Wayne, Indianapolis,
Right.
Hammond, South Bend.
Yeah, we know who they are.
Yeah.
It's like 5 cities. Yeah.
Yeah. So we're saying we're going to take away revenue, and we're going to tell you to figure out how to raise your taxes otherwise in your community to pay for this.
Yeah.
I mean,
okay. So.
And I was just going to say in Bloomington.
Wow, that's really deep, though. No, well, wow.
No, that was well explained and pithy. I like that. In Bloomington, I give you an example. They talk it over forever, and then they always land in the same spot. We're going to raise taxes. So they have.
Because what other choice do you have, right?
Meeting, and then they raise taxes, but you're correct in terms of where it lands, right? I often say the same thing about, because I'm a small business owner, I'm a chapter sub S, tax structure. I'm not a taxpayer; I'm a tax collector. My customers pay my taxes. I have to collect enough money to be able to pay taxes. So there's what I get.
Oh, okay. I see
what I have to get from them to pay somebody else. I'm just the middleman in between collecting the money, but my customers pay.
Yeah. And
okay, so that's okay. Go ahead. Yeah.
No, I was going to say, there is a blue-red dynamic to this, right? And so
I think that's fair.
Yeah. And we'll see how it plays out. I know that I can tell you that in the city of Fort Wayne and in Allen County, we're very optimistic about this upcoming referendum for the casino. And, there is hope that if the casino comes here, it will more than make up for the shortcoming. And we will be able to support our firefighters and our police officers in the way that we'd like to. Nobody wants to take benefits away from their first responders.
Right.
No, definitely, because
yeah,
definitely.
Yeah, no, the gambling, the gambling operation in Orange County, where Baden Springs is, and they have that giant conference center and just everything they built down there. That saved Orange County. I mean, Orange County was just a poor county until that came in.
Yeah.
I'm processing all of what was just said, and I'm just realizing it's as if the state legislator really did bring the situation back to each municipality or each community to really figure out what are they going to do to figure it out, because we want to make sure that our public safety employees have the great benefits. And one of the arguments were, some of the questions that some of the HR pros were like, well, why are we doing this? But it looks like it's because there were certain, municipalities that were doing, something similar to this. And then of course, you have some municipalities that weren't. And so they just streamlined it and said, hey, we just want everybody to kind of do this one thing. So now it's forcing some of these local governments to try to figure out, what are they going to do to raise their tax dollars or deal with that there might be a famine of great public safety employees that are working in your community.
Yeah, this was really easy for the state to do, right? Because they carry no burden. They're not paying for it.
Correct.
Yeah.
Because they're not paying for it.
Yeah, they get to look like heroes. They get to look like heroes because we love our first responders. So,
that's right.
Yeah.
And everybody does.
Right.
And
It was perfect.
perfect. It was perfect. So but it was just really interesting. And just being in that room, it just makes me think of, Chris, all the conversations about, like, why it's really so important to, I don't know how, I mean, because I didn't catch this bill, but I don't think I was looking for, this particular bill.
No, and
but it's important to stay ahead of it.
Yeah, I saw it too, but I didn't catch it. I
didn't make sense of it until
part where it was former employees. That's where.
This made sense. So we're at 4:30. So definitely want to give you guys an opportunity to talk about some of the things that you've probably been tracking closely.
Right. Well, real quick, because I can't even remember talking about this very much, but we've had a lot, and as most, well, if you're a member of SHRM, and an agency that's in our kitchen all the time, such as DOL or OSHA or EEOC or anything like that, and that entity goes into rulemaking, we just get pounded, right? I mean, here's the comment period, do all this stuff. But we never much talk about it, at least I don't think, I know I certainly haven't, talked about opinion letters, right? So all the agencies issue opinion letters, and usually when the IRS issues an opinion letter, it makes headline news, right? Because the import of that. But the DOL pushed out 4 opinion letters 2 weeks ago, which is more than I can remember pushing out at any one point in time in a while. And they were on issues.
And that's the QR code for anybody watching. They can access the opinion letters if you see the QR code.
Yeah. So the first one, and unfortunately, I've got personal experience with every single one of those opinion letters over my career. But the first one has to deal with if you have a exempt worker perform non-exempt work. And then, usually when that comes up, you're not making a permanent change to their duties or anything like that. It's the company got caught short or something, and we need a lot of work done in a short period of time. And this happened in publishing, almost felt like every other month, like clockwork. But it wasn't unusual at all for the division people come to me and say, okay, well, got an all hands on deck here situation here. We're going to need the exempts to help these non-exempt people get through this knot of work, right? And so then, okay, but an awkward question always with the exempts. Well, how many hours have they been working? Well, the answer typically for an exempt in publishing is they've done their 40 by Thursday. That's just the way publishing is. And so then when you have them do this non-exempt work, well, then the issue of overtime pay comes up, right? Because they're doing hourly work, and it's excess of the structures of their job or anything like that. And so this one, I swear, it's always typical. Every time I open something, I'm like, this is going to be a hospital. And it was. It involved nurses and people like that. Nurses are non-exempt, right? Despite their high level of medical knowledge and training and everything like that. They're hourlies. And so the issue here was, okay, well, you take the charge nurses who are exempt, right? Typically, as you move up through the nursing ranks, right? These folks are promoted; they come up through the ranks, so it isn't like they don't know the work, right? But they go up, and if you have them go down, what do you do? And so this was to clarify that, and when and where and how the overtime is calculated properly on what basis. The next one is bonuses, which is a nightmare calculation, always has been. I'm sure, Rachel, you're already nodding your head. And this is why bonus programs don't exist for hourly employees. It's not that management doesn't want to do it. It's just nobody can figure out a way to do it without pissing people off.
And I would say, Chris, I'm going to counterpoint you. They do exist. They just don't exist, and they're not properly allocated.
I know. I can't tell you how many times I've been hired. I go into a new client and I ask them about their bonus programs, and I'm always waiting for them to tell me they do something for hourly people. I've never found it done right, Rachel. I mean, not one
Or
time.
the commissions, the monthly commissions. It's a disaster.
Yeah.
Yeah.
It's just a disaster. And so they've got whether or not that should be straight time or overtime. And then whether a meal break is compensatory when traveling voluntarily. Originally, Tracy, when I was talking to you this week, I thought that was involving people doing, Rachel, the most familiar I am with this is when you've got, this involved a client that had autism and behavioral clinics. Mm-hmm. And so oftentimes there were people whose job it was to, spend some time at one clinic, drive to the next, drive the next, et cetera. And these oftentimes were hourlies, and they were either pinch hitting or helping or doing something like that. And so they were compensated while they were driving to each of those locations. That's portal to portal, right? Mm-hmm. They were directed by the employer to do that. And so it would always come up as they would say, well, wait a minute, I usually get a meal break when I'm at headquarters. But I can't do that when I'm doing that. So I just get Wendy's at a drive up and eat while I'm in the car, right? As I go. And so, should I be compensated for that in addition to the traveling thing, right? And to keep the peace, I was like, I don't need to deeply analyze this. Pay them. It's a half freaking hour. Why do you have a war over that? Just pay them. Right. But this one involved, this was a hospital also involved a nurse. And it actually involves her walking from one end of the hospital and then going into a restricted area, which isn't commonly available to people, and then moving through the restricted area and also doing that. And so the person's eating and walking, but they're in the same location the whole time, right? So it must be a ginormous hospital. And so they've said, look, then that's going to be compensable if you're suffering them to go from one end to the other, and that's over their natural scheduled milk break or meal break, and they're walking and eating and, as they go. So, so they had that one. And the next one I thought was, Rachel, when I looked at it, I thought it was a donning and doffing letter. And I'm like, oh my God, if I see another.
Which one are you talking about?
This was, this had to do with.
So 26.8.
This is 2026
Oh,
-8.
God. Yeah.
And this has to do with, unsurprisingly, nurses. And so this has to do with certain pre-shift activities that have to be conducted. And I had a front row seat to this, unfortunately, because I was hospitalized for a week back in the first part of May. And so my room literally sat, so I had kind of a catty-corner look at the big nurse's desk on the floor I was on. When I said big one, I mean where most of them sit. And so I got to view shift change. That went on. It felt for me, I didn't time it, but I did look at the time, when the shift change started, to kind of get an idea, because I'm an HR pro, so I'm just pay attention to that stuff, right? So I just, when does this shift start, and kind of
instead of thinking about what you're
and what do they do? Well, you can't turn it off if you do it for a living.
Right?
Yeah, I mean, so I'm just watching, right? And so they spent about 20 minutes just talking about sports, TV, what's going on, this and that. It was just chit chat for like a solid 20 minutes. And then I'm like, do you guys ever do handoffs like with me, since I'm a patient, you just kind of parochial, right? Is anybody going to say, hey? And then bang, with like 5 minutes left, they all shut up, and then everybody moved behind the desk, and they were just like looking at the screens and getting this and getting that, and here's this and here's that, and then boom, they left. So it was a pretty interesting deal. And the nurse on the new shift came in to my room about 15 minutes after that and introduced herself, said, hey, I'm the nurse on the shift. I'll be with you for this amount of time, and I'm going to be back with some meds for you in about 15 minutes, and I got to take vitals. And I'm like, cool. And boom, she was gone. And so they got it done, but it seemed very much to me like a natural rhythm, right? Now, how that was compensated, I have no clue. But the issue here, and Rachel, I'm sure you're going to cringe when I tell you this. The hospital was just basically saying, hey, look, we're just going to round up the clock in time and call it good.
What do you mean?
That's what the opinion letter is saying?
They were rounding up the time. So let's say that they rounded up the time to the scheduled start time, so that would be permissible. So they're just going to clock everybody else in at the same time.
Oh, wow.
Is what they were doing.
Regardless of whether they were actually clocked in, not working.
Whether they were working or not. Yeah.
Okay.
Yeah. And I remember with my worker, this was back at the publishing company again, we moved from time sheets, time punch-ins, right, to doing it on the computer. So you had to fire up your computer, sit down, punch in, and now you're in.
Yeah.
But the issue was in how I talked to people about it. I was like, look, if your morning ritual, because everybody's got a morning ritual, and I did not want to mess around with morning rituals, right? I had no intention of doing it. And I said, look, here's the deal. When you punch in, we begin paying you. So punch in means you're at your desk, you're at your screen, and you're going to be engaged with work, which from my standpoint was a very reasonable assumption, right? You're sitting there, it fires it up, boom, it was punching in. And so what I said to everybody was, because this was a behavior change, right? So you all know behavior changes are always the worst, right? 25% of the people were guaranteed to say, how do I punch in? Turn on your computer, please. But what I told him was, hey, look, whatever your ritual is, whatever you do, you get your cup of coffee, you talk to this person, you get a protein bar, you grab an apple, and because I always had that stuff in the break room, right? Because I wanted people to be, have fuel, right, to work. And so I said, if that's you, that's cool. So we're going to be making this change. And so what I want you to do is kind of clock yourself. Kind of how much time does that take? What do you do? And then give yourself that back off, right? Just come in. And that way, when you sit down at work, boom, you're working. It's not you're working and then you're not.
You sit down to clock in and then you go get your coffee. And
yeah, right, exactly. And so I was trying to say, do what you're doing.
That's the way.
Do what you're doing. Just make sure you give yourself enough time.
Yeah, right? No, our staff, that's what happens. So,
yeah.
And
and it took a while. It took a while, but they actually complied with it because a number of things happened, right? Because the phone's ringing, emails are coming in. There was just, the natural rhythm of work, if you will, started. And so they got around it. And we really didn't have a lot of people abusing it to begin with. I mean, everybody was concerned that, wow, I'm going to have to come in a half an hour early, only to find out they clocked themselves and it was like 6 minutes. You know?
Yeah, but you get yourself into trouble in that when you have, say, you work in a biohazard facility, right?
Yeah.
And
We were just a cube farm with
But you've got to put on certain safety.
Exactly. Yeah, there was
that
no
kind of,
donning or doffing or you know.
Right, and so that's kind of what Chris was talking about earlier. So that's where these cases get really gray. Is like, okay, get in your coffee. No, you should do that before you come in. Be ready to go to the workstation.
I had one client that they were a medical device company, and so man, I mean it's like, you know, you stop drinking any liquid like 3 hours before you go to work, because once you get suited up and everything, of course they couldn't take phones in or anything, you know, any of that stuff. And then they got to, you know, do that and then go through another process, inspection, decontamination, and then, you know, all of that. And they kept on finding ways to make that more efficient and trim it or whatnot. And they just couldn't.
Yeah.
They just couldn't. I mean, that was a solid, I think it was 37 minutes on average. Yeah. And it just was what it was.
Yeah. And so we've always got to pay our employees in that situation.
Yeah. And so they started paying them the minute they showed up.
Okay.
Necessary work related.
Exactly. Right. Yeah. You can't. Yeah. The standard I've always told, you know, the employer, if you're suffering the employee to do a series of things prior to work, right? You're requiring this, you're doing this. This is in essence part of the job. Then that's work. That's actual work. It may not be, you know, the job description kind of stuff you got, but that's work, right? The minute it becomes involuntary.
What did you gather from the opinion? Because it sounds like the opinion is stating that, you would pay it because.
Well, first of all, they made it very clear that these were narrow. There were narrow applications. That's like the first thing they said, right? You know, these are meant to clarify
at the end.
and they only apply to, you know, these narrow structures. So that's why I'm trying to draw the distinction between rulemaking, which is very broad, going to affect everybody, you know, do all this stuff. Whereas the opinion letters deal with specific, you know, circumstances.
And Chris, my takeaway.
So then let's talk.
Hang on.
Okay, go.
Rachel was talking about her takeaway. Go ahead, Rachel.
That's okay. I was just going to say nothing has actually changed. It's just a continued clarification of the law as we already know it, right? So none of this is technically new.
No.
But it just helps us. It gives us more examples. When we're not sure of our specific facts, to go to these letters and say, like, this is what if they're looking at a similar situation, this is how they do it.
And this is and I'm glad you gave that clarification, Rachel, because that's what I'm trying to draw, Tracy, the distinction between opinion letters and rulemaking, because the opinion letters give clarification. She says it's exactly that, because God knows HR can manufacture so many, can you believe this, or I've not seen this before questions.
But I want to take it a little step, you know, ahead of this, because I know we kind of jumped into the opinion letters. And when I first started looking at opinion letters, I was just reading opinion letters just because, you know, in the beginning I was new to HR and I just felt like I just wanted to surround myself with a lot of information. But let's talk about that opinion letter process. Just in case if there's people listening and they're like, okay, you're saying opinion letters and rulemaking, but okay, what are you really talking about? Can we kind of go through that process? What are opinion letters? Who would use an opinion letter?
Yeah, so usually the reason agencies issue opinion letters is that they've received a question. Right? I mean, that can happen all the time. As a matter of fact, tax attorneys send questions to the IRS every whip stitch, right? And so that happens across all agencies. And what they'll do if they get a really good one, or one that's material, or one they think they can use to add clarity or something like that, then they punch it out.
And each one of these
opinion letters.
is a very common pitfall of employers, right? So these are complicated issues that when you look at the rule, it doesn't feel clear, right? Meal breaks. Okay, 20 minutes and less, you don't have to pay. 30 more, you automatically do. What happens in between? What if I'm traveling? Right?
Yes.
The bonus structure, the commission, when I'm an hourly employee. And now I've got to take that monthly commission, break that down into the hourly rate and figure out what the overtime rate is on the base rate. And like, and so, I mean, even as an attorney, when you're trying to explain this to your client, you're going, God, I know, I've just talked myself into a corner, and so like pre-shift and post-shift activities. Okay, we'll get your coffees not, but maybe you want me to do something else that's maybe not necessary for my job. But where does it fall there? So these are the kind of letters that we see on situations that are hard for most people to understand, that even attorneys, that we're always looking to guidance to see if there's an update, if there's new clarification on how we should be reviewing this, because it's not clear and they don't do a great job in rulemaking. And so we rely on them to come back later and say, that's what we really meant, when we said that. So
and they can, and they'll get feedback on the opinion letter, right? There's also a feedback loop, and people can send in, hey, wait a minute, did you mean that? Or we've got this or whatever. And they're really genuinely, I believe, trying to help. Just do that. We lose sight of that sometimes. They're not here to bedevil us necessarily, but
they get inundated.
No, I like the opinion letters. Yeah.
If you wrote them one and you said, do I have to pay overtime to an employee who works over 40 hours a week that's not exempt, they're not going to answer you. They're going to be like, read the rule, but on these issues, and other agencies are similar, they're going to be like, we get that a lot, actually. Let us help you, let us give you some clarity. So
Now, does FMLA, because I feel like that's the one that I used to read all the time, but now I'm just like, sometimes my mind, does FMLA have opinion letters as well?
Oh, yeah.
Do they?
Lots of them.
Okay. So then I think that's the one that I used to read all the time, not the FLSA. I guess I didn't even realize that, but I do appreciate that they do talk about different situations, because I felt like I was dealing with complex questions that people would ask me, and I would just start just reading them for fun, just so that I could kind of make sure that I understood how that works. Am I delaying? Because I feel like I'm completely delaying. I apologize for that.
No, that's okay. I was going to say one time, and sometimes opinion letters can morph into later a rule, and I cannot remember the exact opinion, but it was an IRS opinion. And I read about it in the Wall Street Journal when I first started reading the journals. So that would have been on 1986. It had the origin of it is some tax attorney had asked a question of the IRS, and so they issued this opinion letter, and so they published it, and the Wall Street Journal wrote about it. It was like, who on earth would ask that question? You have provoked. And so the IRS ends up making a rule and nobody wanted it. It all started because somebody asked what more experienced people said, oh, for God's sakes, don't ask that question. We don't want the answer. And I can't remember.
That is funny.
I can't, so they can go in different directions, but that's pretty rare. It's pretty rare.
Okay, so then that's
anyway,
super cool.
I think
we have about like 7 minutes
here.
Yeah, 7 minutes. So, is there anything, Rachel? Because it looked like you had something.
No, just if you wanted to move on to the kind of the EEO topic, which
the labor contract. I was gonna.
Oh, the labor contract. Sure.
Go ahead.
Sure. That's a fun one. So, and it's really interesting.
She said that's a fun one.
Yeah. Well, so what it's proposing to do is make it easier for labor unions to unionize in non-union shops. And right now, the initial bargaining process, collective bargaining process, for the first, and most of this is focused on that first collective bargaining agreement. It can
Right.
take
The
a
initial.
really long
Yeah.
time because there's a lot to digest. And let me see, I've got one over here, a collective bargaining agreement, and this is for a federal one. You know, we're looking at 52 pages with signatures, small print, and so you know these evolve over time. But but what they're proposing is to give a very limited time frame in what that initial collective bargaining agreement, how much time can be given to create that first document. And what the thought is that employers drag this out because, okay, this company is union. Frankly, at the point that you get to this agreement, they've probably already been recognized, but it's just a holdout. And there's a lot of, for this new company dealing with this, what the heck is going on? Oh my God, you can't actually be making us do that, right? Like, I mean, there's a lot, it's a huge change, especially for small companies.
Oh,
And
yeah.
so they might drag it out. And right now there's no statutory limitation on that specifies how long this process can take. And so what they're proposing, I think they've given them like 90 days.
Oh my gosh.
Something like that to come up with the first one. And if they
to draft the initial agreement?
Yep. Let me go back. It says
I saw something that said 10 days, but I don't know what the 10 days was about.
They start it within 10 days of written notice. If they don't reach an agreement with by 90 days, they can request mediation or conciliation service, which is something they didn't have before.
Yeah.
And if they don't have an agreement by the time or within 30 days after the request for mediation, absent an agreed upon extension, they can get an arbitration panel. So yeah, I mean, it is like boom, 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 boom.
Yeah.
Yeah.
Have you ever, Rachel, have you ever seen an initial done in 90 days? I mean,
No.
I mean,
I rarely see
Really?
a
So what's
current
typical?
one.
I usually
So what is
avoid-
normal?
Well, go ahead, Rachel.
So normally they happen in sessions, right? So we're going to block out a week or two. And I'm not speaking for like GM or the UAW.
Right.
I mean, those are huge.
No.
And and when they reopen those, we see what happens, right?
Oh,
Strikes and things like that. Most of my experience is in government, but we typically open up for a week or two. And then we get as far as we can. And then we schedule out in a couple months, maybe the next month if we can get another week blocked out because it's hard to get. And they bring in their national representatives. You know, it's a big deal. And so it often takes months.
Okay.
And then by the time you get to the end of it, the union has to ratify it, right? So they've got to take it back to their membership for a vote. Whichever the organization is, they've got to get it back to their board for approval, typically, especially if you're government or city council approval, kind of whatever that is. And so,
gotta go
it's
through
a
that.
big undertaking. And that's why it doesn't happen very often. It's every couple of years, typically. And it's expensive because you're paying lawyers. You've got your, and if you can't come to an agreement, then you go to arbitration, like I just was mentioning earlier with the fire department. And so this is, this feels completely unrealistic.
Oh, no.
And actually, it says here the current average of bargaining a first labor agreement is 461 days. So 461 days. So it normally takes
a little bit more than a year.
Well over, a year.
Yeah.
So
this is drastic.
Yeah, because what Rachel's describing is, how do you eat an elephant? And the answer is one bite at a time, right? So she was describing.
But it looks like you're gonna have to shove it down.
I've got a client. I've got a client right now that is in the opposite situation. So they recognized the union for this one division in their corporation 3 years ago, and the union still hasn't been able to. The representatives still haven't been able to find the time to actually, draft an agreement. And so, they're just the HR VP there finally said, "Okay, look, ball's in your court. I'm going to quit asking. I mean, you guys tell me. I'm tired. I can't drag you into it.
And there's, so many things that go into this, right? So if you're bargaining over benefits. benefits. I mean,
Yeah.
So we need to know. We need to be working with our brokers, right? We need to be working with our ERISA attorneys. We need to know what the actual cost of this is to the company over the course of years, because that's typically the impact. We're looking at uniform costs. Okay, that might be a simpler test, but you've got an entire team of people who are, working typically around the clock. These weeks are long, and they're
wall to wall.
Yeah.
Yeah.
And so
Wow.
to do this, particularly with the first one, a little over a year doesn't actually surprise me. That feels reasonable.
Not at all. Not at all.
So I don't know how in 90 days.
This
And Tracy, another wrinkle in the initials is that management may or may not know, oftentimes doesn't, because in the process of getting the union established and recognized, the management is prohibited from surveilling. And so oftentimes they don't know. But you don't know what the union promised the workers it would bring to the table, and where it's illegal for the employer to make promises and say, hey, you guys don't bring this union in and I'll do this and that and the other.
you can't do that. Yeah.
No, you can't do that. The union has no bar against telling people the moon, right? And so in the initials, I haven't had personal experience with this, but I've had professional colleagues tell me that when they get to this part of it, Rachel, the comp and the bin, that's when it comes out what they promised, like no cost health insurance and, all this other stuff. And of course, they know they got to get it ratified, right? I mean, they know what they've got to do. And now they're the ones that have to sell it.
Yeah.
And I remember one place here in Bloomington, it went kablooey right there. Because the agreement that they brought the employees were like, this is no better than we had, but now I have to pay dues.
Yeah.
And I'm like, well, oh yeah.
Well, and you will typically find that your executive committee for the union, or what they call their e-board, and I'm not speaking about any union in particular. I think that this is very common. They're the more experienced long-term employees.
Yes, they are. They're pros. They're pros.
But when you're, and so that they understand the process. But when you're starting a brand new union, and they don't know. They're learning too. Your company is learning, and so again, this like kind of what's norm, what's reasonable. That you're creating the wheel in some respects.
Yes, that's a real good example. You're building the wheel.
Yeah, and then one of the challenges when you've got a more experienced e-board is that we all are a little self-centered, and so they are looking at the more long-term employees, and so when they don't get ratified, it's often because the benefits and the wage increases are going to really focus on the longer term employees.
Sure.
And then they're like, yeah, but we can hire temps for the new folks. We can,
right. No, they're all about seniority, and the rest of it can go to hell. Yeah.
I think that happened.
Well, the U.S. House did pass it. Go ahead.
No, I
was going to say that the U.S. UAW. So it looks like it did pass out of the House. It's called the Faster Labor Contracts Act. And it's moving over to the Senate, but they're not sure how the Senate is going to.
Oh, the Senate's not going to.
So it passed yesterday. So
Senate's not going to pick that up.
Oh, you said the Senate's not going to pick it up?
They might pick it up.
Okay, so then this is not something.
They don't have the votes. They don't have.
Okay. They don't have the votes.
No.
Okay. Well, then
the Republican Senate passes something like this. I can't believe the House passed it. But if the Republican Senate passes it, and then what the administration will do with it, I mean, I feel like this is something that might get vetoed.
I agree.
Okay.
I think him vetoing that.
Okay. Because they would be going against the employers, especially if the employers have an issue with this, right?
Actually, I think the president could play that two different ways.
Yeah.
The best way, I think, would be have it passed and then veto it and shore up that, he doesn't believe this is good for workers, right? and do that. That would be the politically smart
Okay.
way to do it. The other way to do it would be to say he supports it, and then have Cornyn, McConnell, let's see, Alaska, help me.
I don't know.
Yeah, I forget her name now. I should. Yeah, I knew her dad. Darn it. But anyway, the previous center, but in the fourth Republican structure, but they would vote against it. So
Okay.
he could play it either way. But I think that the smart play. I agree with Rachel. Smart play, let it pass, veto it. But
Okay.
that thing is not workable at all. At all. I mean, keep in mind all the pressure here too, because this is a multi-year agreement. So that's stacked on top of the whole thing.
Right. I think it says minimum of 2 years.
So it's requiring a minimum of 2?
Let me see here.
Yeah.
On extension. Yeah, I thought I saw 2 years in there.
Yeah.
Don't quote me.
But in any event, it's a
okay.
Right? Yeah.
Because it possibly can get too expensive for employers to really do it. So then now
unfair.
you're just
It's unfair to all parties involved, quite frankly.
okay. I didn't look to see who brought it out. Are we saying that it's more of a blue, and that's why we think that it's not something red is going to push through?
Who's the, I don't even know who the author.
Blue Democrat. I just don't want to make it all political because I know we talk about it's not politics, but it is politics. So I guess I look.
Yeah, this is definitely viewed as an employee-friendly, union-friendly bill. The goal of it, the intent behind it, is to prevent employers from dragging their feet and entering into a collective bargaining agreement.
Right.
And if they want to do that, and this may be and this has been something that Trump has done 1,000 times over in each time he's been in his position, and so maybe he's somehow behind this. But give him the worst case scenario, and then we'll come back with something that everybody can swallow, you know. And so maybe there's something here because he has received a huge allegiance from the labor movement.
From the yes,
and many would argue against their own interests, but they are loyal to him. And so, in the first administration, he was very anti-union. And then he made a lot of promises when he was running for this campaign. And I don't know that I've seen any of them really come to fruition, but maybe this is one of them.
Well, it showed up in his appointment.
Okay.
Yeah,
because you did say there was someone who's a union lady.
Well, yeah,
right?
and she came from a pretty heavily unionized district. I mean, there was a good reason.
I remember that.
Right? And I think her husband was in the
okay.
union too. But she ended up having an affair with, I think, her security detail.
Oh, okay.
Maybe that was somebody else. I get confused. But anyway.
Okay, because whoa. Okay, whoa.
Yeah. So anyway, so she's gone, and we have the new guy in. I forget his name. Yeah.
Oh,
but,
okay. I didn't realize that. Okay.
It would not be.
No, we're
DC.
like.
It would not be DC if there weren't at least 3 sex scandals.
Oh my gosh, that is too funny. That is way too funny. So I know we're like 8 minutes over.
Yeah.
Go ahead.
Yeah.
But we are 8 minutes. Okay.
Both of you are too young. None of you remember Fanny Fox, do you?
Fanny Fox.
Fanny Fox. She was an exotic dancer and the mistress of the guy. Oh, I had his name in my mouth and I dropped it. But he was the Speaker of the House, and he got drunk, and she was in his car, and he drove it into the basin in front of the Jefferson Memorial.
Oh my!
Annie Fox. I'm gonna look that up. Just now, I'm curious about that. That's way too funny.
Wilbur Mills. He was from Ohio. Yeah.
That was a bad day for him.
Ohio.
That's a bad day.
No, that really isn't. You're like, Will.
There you go, Rachel.
Okay.
Anytime you think you're having a bad day, just remember that and go, it's not that bad.
Yeah.
Wilbur.
Sounds like Wilbur was having a great day
definitely.
until it wasn't anymore, right?
Yeah, for sure. For
All
sure.
right.
So
Well,
now we're
so
like
good.
9 minutes over, and I want to honor your times, honor your time that you set aside for yourself. This was a great conversation today. I think that we've kind of touched on quite a few stuff, and I always, all the time, I appreciate both of you. I really do. I just think that, you know, you guys are a blessing. For sure. So just thank you for being a part of the show and sharing your wisdom. But until, you know, if you guys have any closing words, if not, I'll just say, you know, until next time.
No, I was just going to say, I'm
Anything?
so glad to have Rachel back as the voice of reason. So, yeah.
No, this is so fun. I'm sorry I missed last time.
Yeah.
No, I enjoy it. I enjoy the collaboration, and it's lovely to work with both of you. So thank you.
Very good. All right. Till next time. See you
Thank
later.
you.
Yeah.
All right. Bye, everyone.
Bye.